This is Nan McKay, and I would like to introduce you today to Richard Taylor. Richard is a visionary, a strategist, and a change agent for solving community-based challenges through the strategic use of information technology, with a focus on the social detriments of health and complex community care scenarios, such as addressing the opioid substance use disorder epidemic and building back better from the COVID-19 coronavirus crisis. Richard is the vice president of eTransX, a national software company focused on the creation of innovative solutions for value-based healthcare and community well-being transformation. So welcome, Richard Taylor.
Thank you, Dan. It's great to be here with you today.
Let's talk a little bit about your company's mission. What is your mission?
Our mission is helping people and communities reach their full potential, one person, one community at a time. And we accomplish that by working with community-based organizations to bring them together to help identify what are the needs in the community and how can we best coordinate the delivery of services to meet those needs.
You know, I'm kind of feeling like we're in a perfect storm. What do you think?
Oh, yes. I mean, as you can imagine with COVID-19, as with the racial inequality that's out there that has been exposed, that we indeed have identified that there are a lot of people in need, a lot of communities that are struggling right now. And so now is the perfect time to use technology to help leverage, coordinate, and scale efforts to identify those needs and help address those needs.
I think as our population ages, more people need a combination of both a place to live and a supportive network of coordinated care. What role do community care coordination technology platforms play?
As you can imagine, the senior population certainly is at that risk as they grow older, as they want to stay independent as long as possible in their lives. And this is going to require help from the community because many of their family members have moved away or may not be local or may not be available. They have their own challenges. And so how can we identify who those people are that do need assistance in being able to live independently, and then identify who are the organizations, and these can be government agencies, these can be nonprofits, these can be organizations that are out there that provide services. But right now, as you may, and as I have with my parents and my wife's parents, it's a full-time job almost just to find out what's out there to help our parents as they reach that stage of living alone or living where they needed help. And so our system provides that community resource directory of resources, but more importantly, it provides a way for you to build a personal success pathway for all ages, not just seniors, but for young people and for adults, as to this is where I am now, this is where I want to be, how am I going to get there, and what help can we coordinate to make that happen?
So where would the technology be utilized? Would it be like an individual logging on, or care centers or assisted living, or how would it work?
What we try to do is find what we call an anchor organization or a backbone organization in a given community that would be the sponsor of our system, because they already have those trusted relationships with the other organizations in the community and with the people in the community. And so they would bring our system in, and then we would onboard the organizations that help people in that community. And that can be housing, that can be food, that can be employment, transportation, healthcare. And so they become users of the system so that they are using the system to identify people who have needs. A system that most communities have is a 211 system where you play a phone call and says, I have a need. And so we would connect with that local 211 system and say, yes, these are people that have been identified that need help. How can we now connect into our system that says, okay, here are the organizations that we might want to identify to work with those individuals to help them develop a plan and manage that plan. And so the users include the organizations that provide services. We also have the ability for the consumer or the client and the family members to log into our system using their phones, using their smartphones, tablets, or laptops, so that they have a way to engage. And then we also connect that family member or that individual support team, so they can bring in their friends, family, coworkers, church members as part of their team. And of course, we do this in a secure manner that's fully compliant with the privacy and health regulations, so that we do protect that data and who can see it and who has the rights to see the data.
Now, you've identified several needs. Are there 7 needs? Could you tell us a little more about that?
Sure. What was happening, and this has been happening on a national level, we call it the well-being movement. And it started back in the 90s, when it was realized that 80% of the factors that influence a person's health have nothing to do with the clinical services. It has to do with their lifestyle. It has to do with their home environment. It has to do with their income. And so this became known as the social determinants of health. And again, 80% of the factors involve those factors that are controllable factors, as opposed to healthcare factors or genetics, which are more difficult to control. And so we started there. And so as we're building approach, that we identified these national organizations, the Wellbeing in the Nation, with the Wellbeing Trust. And they worked with other federal agencies to come up with 7 vital conditions for well-being. And those 7 vital conditions are, these are the things everybody needs to be successful in their lives. And that includes housing, that includes transportation, that includes health services and health access to prevention services to keep you healthy. And it involves the need for your environment that you're around, your physical environment. And then the one that sort of ties it all together is the need for belonging, the need to be part of the civic society. And that was what they identified as that 7th area is the one that sort of ties the other together. Because in this day and age, there's too many people that are kind of isolated, that are off by themselves, that don't have those personal relationships. The book Bowling Alone, that was popular a few years ago, identified that need to have that community connection that so many people no longer have or don't have enough. So those are the 7 vital conditions that our system is designed to help address at that community level and at that personal level.
Well, I would think people are getting a little more used to dealing with technology, even older people, because we've got the online portals from the doctor offices. So now everybody can access their own records. We have the telemedicine visits, so that we're doing that over Zoom. So this won't be, I don't think, such a big stretch, because they're already using technology for health, aren't they?
They are, and that's one of the beauties of our system, because it is a community-based system. If they happen to have a portal where their healthcare information is, they can connect to that with our system. Because most people have multiple doctors and they see multiple hospitals, and so that data is scattered everywhere. So you can bring that data together with our system. The same thing with their other information that they may have related to their career or their job and their training is another way to bring information together. And like I said, our system is designed to be as a phone app, so that if you're used to using a phone app, then it's easy to use. And we purposely design it to be that way, so that our system is also role-based. So depending on what your role is, if you're an elderly person, you're screening a young person in their 20s who may have other capabilities. And so that way we can customize the screens to look for what they need in terms of their interactions.
So we have a problem in the housing area, and that is that people have been isolated, especially with COVID, and therefore housing is the only component. What you're trying to do, I think, is bring the other component to them, so that even if they are isolated by COVID, they still will have some ways to have some resources to give them meeting their other needs.
Exactly, and that includes being able to connect them, because most at this day and age there's not many face-to-face visits going on, and so if you have a healthcare person in your doctor's office, or you have somebody you're working with on your job skills, or you have somebody you're working with to find new housing because you're about to lose your housing, then those individuals can now interact with you securely using our platform. And so instead of you having to log into 5 or 6 different systems to access those individuals, you log in as a client, as a consumer, you log into one system, and then we connect the other people together. So that way it's easier. And you have all your information in one place that can be shared with those 5 or 6 different organizations that you're working with. And that can include your civic organizations and your Rotary Club and your churches and other things and other places that you may have your gardening club or whatever. Or your 12-step network, we can connect whoever you want to connect. And again, instead of you having to log into 5 or 6 different systems, you log into one system and we do the back end connections for you.
Is this available all over the country?
Oh yes, we'll go anywhere. We have today, the communities that are using our system today are located in Tennessee, Florida, and South Carolina. We're in discussions now with communities in Michigan and Illinois and Texas, and so we're certainly in the process that we'll go wherever the opportunity presents itself.
And so do you have something like maybe assisted living home or a nursing home that might call you and ask you for the service, and then you go up there and you look at the whole community and figure out where the services are and connect it all?
Not so much on assisted living, and because they have things self-contained within their system. It's mainly people that are living in independent living apartments or facilities. Those are the ones that are still independent, and those are the ones that still need to interact with the other community-based organizations. And so the nursing homes and the assisted living have internal systems because you have limited mobility and limited access to the outside world. And so that's why we're not as much focused on that. What we can do is once somebody determines that they can no longer live alone, then we'll connect them to what's available in the community in terms of assisted living and in terms of people that may come to live in your home as an option for you to where you need additional help.
So do they subscribe to your service?
No, how this works, the consumer, it's free to the consumer. The people that subscribe to our service are the community organizations that provide the services because it helps them automate their functions, so it improves their ability to be more productive. And so they pay us, and then we give them a license for so many clients that they serve. If they serve 1,000 people, then they'll have licensing to serve 1,000 people. Or if they serve 200 people, then it's, we base it so that the smaller agencies, it can be affordable for them. And then they pay, and then the consumer does not pay anything because we're working with the organizations that have a coach or a caseworker or a navigator that they're system helping an individual that needs help as opposed to a consumer-based system that a consumer would subscribe to.
Interesting. Let me ask you one last question. What do you see as the future for this area?
We believe that because of COVID-19, because of the great disruption that has occurred, that every community in America will want to move to a system like this because they're so overwhelmed right now with all the demands for housing and food and jobs, that this is a system that can help coordinate and put together a way for the community leaders in each community to have a platform that says, yes, we can help people in need, and we'll have a platform to not only identify who those people are, but able to connect them with the people that can provide the services, and then making sure that the people services that we're closing the loop, that once it's not just a referral, go call this group, that we'll find out, did they actually receive the service? If not, why not? And then we have a way to follow up if there's problems. But as you can imagine, a community having this type of system, you don't have to wait a year or 2 years or 6 months to find out who has needs because you're capturing this information in real time. and you also know in real time what the capacity of the organizations that are providing services. So you know where the gaps are, you know what needs to be filled. You can set up waiting lists if you need to with our system, but it gives you real-time information. You can more quickly respond to the need and identify where gaps are. And so we believe this is something that every community will eventually move towards, because in this day and age with COVID, we realize that technology is going to be more important than ever to be able to communicate and share data. And so we believe, as bad as it is, that it's actually has a silver lining in that it will give communities the opportunity to build back better using technology to help them scale that effort. And it's technology like ours that's available today. They don't have to build it. It's available today, and they can get started right away.
Well, Richard, thank you so much for sharing all that information. I think there's so many people out there that are going to be thrilled to know that this is even available. So that is terrific.
Yeah, just one last example that we had a community in Illinois that identified they needed a system like ours, but they didn't know about us. And so they were in the process of hiring a programming company to come in and build this system. And then they found out about us and they said, oh, wait a minute, we don't have to build it. It exists. And so that's why your show and your audience, we're hoping to spread the word that there is something out there, people. Just give us a call.
Well, that's great. Thank you so much.
Well, it's been a pleasure. I've enjoyed being with you today, and certainly we do believe that we have a piece, we have a tool that people and communities can use to build back better from this crisis. And let's turn a negative into a positive. As the saying goes, never let a great crisis go to waste. That's how we look at it.
Thank you.
Thank you, Nan. I appreciate it.